So we have two programs right now that we're assisting the schools in implementing. One is going to be the Character Strong program, which is a character building and resiliency building program. And then the second one is Hope Squad. And the Hope Squad is primarily focused on suicide prevention. But that program is a peer-to-peer school-based program where it really is broader than just suicide. It really addresses all behavior health with kids at the school level.
And part of that with the Hope Squad is QPR training, which is a suicide prevention program. There's a variety of different educational programs for suicide prevention. That QPR is one of them that we endorse here. It's research-based. There's a lot of research behind it regarding its efficacy, and it is one that is greatly growing. Right now, I can tell you that every single teacher in the county has taken QPR trainings. It's customizable for a variety of groups, and including students and teachers. I've taught it to law enforcement and emergency responders as well, just some slight tweaks, but the overall program all revolves around recognizing signs and symptoms and not being afraid to ask the question when it regards suicide.
Looking at what the students are saying in reporting, and then looking at the number of suicides that we have had in our schools over the last 10 years, you know, there's definitely a need to support our students here. Behavioral health and say maybe a mental health crisis or a breakdown can really mimic, say, a hormonal imbalance. It can mimic, you know, a child being super stressed out on something. So it's really difficult sometimes to identify when is it a behavioral health crisis and when is it something else. And so what we want to do is we want to be able to educate the community, educate the kids, educate the families on how to support our students when they're having a mental health crisis or a breakdown. Like right now in the state of, or in the nation, Montana still is #3 in the nation for top suicide rates. And that's from ages 10 all the way up to 45. And so that's a big grouping of us in the community that is possibly struggling with mental health issues. And so we have done a lot to be able to not just educate the kids, but to also educate the families and the community as a whole.
That's one of the things. We're not just looking at the kids, we're looking at the entire community. And so we've got a wide variety of different programs that are targeting that. But the number one thing we have to do is break that stigma and get that awareness out there and get people to not be afraid to talk about it.
All the different conversations that Tim and I have had with the different organizations that we work with, the different community groups, the different trainings we've done, we're getting a lot of positive input from the community members recognizing that this is something that we need to address in our communities. And so from the input that we've received from our community, that's what's driven a lot of these other projects. First resource here is this is connecting you to the county website, and on the county website is a landing page for all behavioral health resources within the county. And what you're going to find on that website is you're going to find a complete provider list. So for all those providers that are in the community right now. Additionally, on that resource list, we have not just local providers, we also have regional providers. So we have folks from Glendive on that list. We have folks from North Dakota, and those are all all these resources have been vetted. On this website, you can have access to the complete resource guide. We have a quick reference list on there for services in Richland County. So whether you're new to Richland County, whether you're, there's some different things that you need access to, that entire listing is on the website.
This app I'm really excited about, and we've got a lot of great feedback on it. This was designed specifically to be used in schools and very school specific site. This list of resources is very specific. This is not just going to your Google and looking up a list or something that some bureaucrat in Helena or DC put together. This list of resources have been fully vetted, and there are only 2 people who can access and change this list of resources, and that's Jessica and I. We used to have cards, and they were great. And say, well, here, just have this card. Well, in the time of crisis, where's your card? Where's your purse? Where's your bag? Where's your wallet? I got enough in my wallet. I'm not putting another card in it. But nobody's anywhere without this. And so we tell them, download this. Another beauty of this app is that right on that front page is that red button, and that's a crisis text line. And if a person is in crisis, they may not know how to get support. We know 911. We also now know 988 if you're looking specifically for some mental health crisis or you're feeling suicidal. But as a society, especially with the younger generation coming up, they may not want to talk to anybody, but they're more than happy to talk with their thumbs. And so if you hit that crisis text line, it takes you right into your messaging app, and you can send a message. It's to 741-741. You can use that at any time, but when it when you're in a time of crisis, you may not remember that number, but you've got that right there. And I tell students all the time, whether it's you who are in crisis or you're helping somebody in crisis, you can get on there, and that is manned 24/7, licensed and educated people trained to provide assistance, and they'll help you through any sort of a crisis there and connect you with the help that you need. Number one thing is reduce the stigma, not being afraid to say the word. All of these different programs, we've got Character Strong, Hope Squad, we've got the Montana Cares app, Adult Mental Health First Aid, Youth Mental Health First Aid, QPR, CIT, CISM, all of these different things. The bottom line for me on all of that is suicide prevention. And to let people know that there are people that want to reach out and help. We want to offer hope, and the hope that things can get better and things will get better. And sometimes we all need a little bit of help.
We have resources available. We're happy to help you connect with those resources. And if we're not able to get you connected right away, we will find the resource and get you connected as soon as we possibly can. But take that encouraging step and step forward and let us be there for you.
We're starting to feel that we're having some success in making these connections, but there is still a whole lot more to be done. With the CIT training that's going to be coming here, what I see as the strongest part of that is it's going to force us as a community to work together. It's going to get law enforcement working side by side with ER nurses along with the hospital. We want to be able to work with Sidney Health Center, and we know that they're doing some great things within their teletherapy. And I've worked many times with their social workers, and they're fabulous people. And we just want to be able to work together, because what happens when somebody is in crisis? Where are they going to take them? It's going to be to the hospital. We have to be able to work with the hospital and know, okay, what resources can they provide? What other outside resources? Because it really is going to take the entire community working together and just getting everybody working together. And we are really seeing the coalition all come together and everybody getting on the same page. And I'm really excited to see where we're going to be in the next couple of years with everybody on the same page supporting the whole concept of community mental health.